Hi, middle school. As you know, we are in the midst of some really challenging and historic times. And as we've kept school going and tried to keep some semblance of a routine, we've made new routines. We also need to be thinking about what's happening in this moment right now. We are living a moment of history that you're going to want to tell somebody's children and somebody's grandchildren about. This moment we're living in will be the stuff of textbooks. And so I wanted to make sure that we had some time to really engage right now about what is actually happening around us. I'm excited that we've got some community members who can help us to understand some different pieces of what's going on in the world right now, how it is and how it will impact us. So, we're doing a symposium on the coronavirus pandemic, and today is going to be part one. I'm excited today that Miss Anderson, our sixth grade humanities teacher, is going to look through the history of pandemics with us. You know, this is not the first pandemic that the United States or the world has dealt with. What have we seen and what can we learn from the history of pandemics? I'm excited to turn it over to Miss Anderson.
Hi, middle school. This is Miss Sanderson. Today I'm going to be part of your COVID-19 informational forum. I am going to be, as one of your history teachers, presenting a short history of outbreaks, epidemics, and pandemics. As you know, we're living through the time period of the COVID-19 pandemic. Many of you have probably learned the basic facts of COVID-19 already in one of your classes or from your families. That it's a member of the coronavirus family of viruses. You probably know that. It can range in seriousness from people carrying it having no symptoms to people having mild symptoms to severe symptoms to death. That there are several actions that you can take to keep yourself and your family safe. You're probably practicing some of them right now, like social distancing and washing your hands. And that people are working on a vaccine and treatments for the disease. But despite having these facts, it's sometimes hard not to get more anxious when you read scary headlines in the news about COVID-19. And it is very serious. I'm not going to lie to you guys about that. We do need to treat it very seriously. But humankind has been through pandemics before, and that's what I'm here to talk to you about today. Because knowing how humans have dealt with it before can be helpful. So as a history teacher, that's kind of what I thought I could offer you today. A little historical perspective about how previous epidemics and pandemics have gone and how humans have dealt with it and come through time periods like this. So let's just make sure we're all on the same page about our definitions, right? So first of all, an outbreak, which is kind of the way that epidemics and pandemics start, right? So it's a sudden spike in a number of cases of a disease, often in a small area. Then there's an epidemic, which occurs when an infectious disease spreads rapidly to a larger number of people, often out of that small area, and spreads around to a larger area. Then there's a pandemic, which is a larger version of an epidemic, and it spreads to several countries or around the world and affects an even larger amount of people. So you can kind of see here, right, the difference between an epidemic, a pandemic, and one of these bugs that go around every year. Like you've probably heard people be like, oh, I got a bug, right? I got the stomach bug that's going around, right? This is not that, right? This is much more serious. It's much bigger, right? And you can see how many times more cases goes from bug to an epidemic to a pandemic. So, unfortunately, humankind has experienced epidemics and pandemics for nearly all of recorded history. So, if you look at this timeline, right, you can see how long that is, right, for thousands of years. So, an example from the ancient world is the Justinian plague. This is probably the first case of what's known as the Bubonic Plague, right, where tens of millions of people died. It's named for the emperor whose time period this happened under, right? It was spread initially by rats and fleas. The Black Death of the Middle Ages, which is the same kind of disease you just heard about, which went on for centuries. The New World, smallpox, it's called that because Europeans brought it to the Americas, which was called the New World at the time, and they spread their diseases to the local population. And then smallpox was around the world for many centuries. The cholera pandemics, which came from dirty water in London. The 1918 flu, which happened after World War I. You've probably heard it compared to COVID-19. And then the Asian flu of the 1950s. So as you can see, this is a pretty regular thing that happens every few decades or every few centuries. This is not unusual in the history of humankind. So why does this keep happening? I'm not going to go too far into the science, but you should just know that viruses can adapt, and they can figure out how to get around immunities that have developed. So that's why the viruses keep coming back, maybe in new strains and new forms. I'm going to let your science teachers go into that, but there are scientific reasons why this continues to happen over and over again. So, but you know who else can also adapt and has often been better at it in the end so far? Humans. That's right. So let me give you some examples. So each time there's been an outbreak or an epidemic or a pandemic, humans have been right there coming up with ways to fix it. So an example of this is the smallpox epidemic. In the 18th century, a vaccine was invented, right? So many of you probably know a vaccine is a medicine that can prevent you from contracting the disease. And then more and more people started to get this vaccine until it was declared officially eradicated from the earth in 1980, which means it no longer occurred naturally. And you can see right here, that's a headline from the World Health Organization's magazine declaring smallpox dead. So it was defeated by human science. It's considered one of the biggest achievements of the 20th century. Another example is that cholera epidemic, right? This was a very mysterious disease at first. Some people didn't know where it came from. Actually, most people didn't know where it came from. So people assumed it must be transmitted through the air because they couldn't figure out the source. But this one doctor named John Snow did some detective work, and he mapped out where the cholera epidemic had started, right? And it ended up having started on this one street with people who all drank from this one water pump that was dirty, and it was infecting people, right? So they were able to shut that water pump down and control the epidemic, right? And again, this is human reason. Somebody just mapped it out and figured it out and tracked it back to the source, and that helped to end it. A more recent, in 1957, there was a vaccine invented in 1958 that was considered to save many, many lives after the Asian flu in 1957. So you see the pattern I'm trying to point out here, right? This is a historically proven pattern, right? That science and human reason have overcome each one of these pandemics that I've named, right? And so scientists are optimistic that it's going to happen again. There's an expert talking to the upper school about this, right? And that's his opinion. He's from the National Institutes of Health. So don't just take this from a history teacher. Scientists also see this pattern too. So scientists and doctors and researchers are working on treatments and vaccines for COVID-19. There has not been a treatment or vaccines discovered for certain yet, but drugs are currently being tested. And it's worth noting that scientific knowledge and tools we have for our current pandemic are vast improvements over previous ones from previous centuries where other pandemics and epidemics were trying to be dealt with, right? So this is a huge advantage for our scientists and doctors. So like in the Middle Ages with the Bubonic Plague, one of the probably the most well-known of the plagues, right? You can't really treat the disease, only the symptoms. So you can see here, right, that like lung problems were treated with licorice, which didn't really work, but they didn't know. They were trying things out, right? Headaches were tried to be cured by rose and lavender, but they couldn't cure the disease itself. They didn't have that technology or knowledge. But even at the time, they were trying things that worked. They figured out ways to contain it and to stop its spread, and outbreaks became rarer and rarer. Excuse me. We now know that the bubonic plague, perhaps the most famous of all pandemics, can be treated with antibiotics, which you've probably taken for other kinds of illnesses that you've had. So humans have now invented something that can treat it. So again, scientists came up with a treatment. We also have the advantage of having government agencies that can help either come up with ways to track the disease or come up with treatments. So for example, the Centers for Disease Control and Prevention. This is a government agency that helps to track diseases and outbreaks and figure out what causes them. And the FDA, the Food and Drug Administration, that approves drugs and treatments and makes sure that they're safe for people to use. So that's another advantage. And remember how I said back at the beginning of the video, don't forget there are things that you can do. It's easy to forget that you do have tools to help make yourself and your family safer. You can do things like following the guidelines of your governor and the CDC on hand washing, staying at home if possible, social distancing, wearing gloves and face masks as needed. And even something as small as shaking hands, staying 6 feet away and not shaking hands, staying 6 feet away and doing one of these alternatives, right? Hey, what's up, right? The wave, hand on heart, right? There are many ways you can do this. And working together, we can see here on this chart, if you watch it cycle through a few times, that if we don't respond together, right, there's going to be more cases and it's going to be harder for the hospitals to handle. No collective response, as we see right there. Whereas if we have a strong collective response, the best case scenario, right, it makes the cases go down, right? So this is what you've probably heard as flattening the curve, right? And that's also historically supported, right? With other pandemics and epidemics, we've seen that happen as well. So to sum up, you can see that having knowledge and science can help humans figure out how to beat this pandemic. That's what's happened in the past. And as we know, we often learn from history to figure out how it's going to go in the future. So I hope you keep this in mind as we continue to go through these difficult times and think about the historical context of how people were able to solve these pandemics in the past. Stay safe, everyone, and please do contact me with any questions that you might have.
Thank you, Ms. Anderson, for your time and expertise on that. I know that I and all of our students miss seeing you around the building for sure. You know, the next thing to think about is what is actually happening, what's the science and what's the medicine behind the coronavirus. And so I'm proud that we've reached out to a St. Andrews alum, Becca Davis, who graduated 8 years ago. She's the aunt of sixth grader Jack Harlan, and she's going to help us to understand from her role as a hospital nurse, someone really on the front lines of this, what she's seeing and also what she can tell us about the science and medicine behind the coronavirus. Thank you, Becca.
Hi everyone, my name is Becca Davis and I'm from the St. Andrews class of 2012. I'm currently working as a nurse at Harborview Hospital in downtown Seattle. So now that you've heard a little bit about the history of pandemics, I'm going to shed some light on the science behind the coronavirus. Coronavirus, or COVID-19, is the name of the disease that is caused by the SARS-CoV-2 virus. So what is a virus anyways? You've probably heard of viruses and bacteria causing people to get sick. These two are similar, but they're also different in a lot of ways. Bacteria are tiny single-celled organisms that live all over the place. Some bacteria can cause illnesses such as strep throat, which some of you guys may have had before, but a majority of bacteria is actually harmless, and some can even be good for our bodies. It can help in digestion and fighting off cancers. Bacteria can reproduce by themselves and live almost anywhere. Viruses, on the other hand, are much smaller than bacteria and can be much more harmful. They can't reproduce on their own, and they actually need a host or a cell to attach to in order to survive. Some examples of hosts are humans or animals. So when a virus enters our body and invades it, our immune system reacts to try to get rid of it. Symptoms such as coughing, sneezing, fever, and fatigue are all ways that our body fights off a virus. Another big difference between bacteria and viruses is in their treatment. So we have antibiotics that are created to fight off and kill specific bacteria and treat whatever you're sick with. And a lot of antibiotics actually work for multiple different types of bacteria. But viruses, on the other hand, we don't really have a medicine quite like antibiotics that works to treat a lot of the viruses that we have. So usually treatment for a virus, such as the common cold, is more supportive. So your doctor might tell you to drink a lot of fluids and get a lot of rest. Because there's so many viruses out there that people end up being okay with, a lot of people are wondering, why is the coronavirus so much worse? So it's not because the coronavirus is any more powerful than other viruses. It's actually because it's novel. And this means that it's new to humans before and has not affected humans before. Because it's new, our bodies have never had to fight it off, and we don't recognize it as a harmful intruder. So I've read this analogy that really helps to understand it. If you imagine an old walled medieval town, and then imagine the virus being a disguised attacker that arrives at the wall's gates. The guards might not know, might not be suspicious of this disguised attacker, and they might let the attacker in. So this is just like the cells in our body. Without knowing what the coronavirus is, our cells let it in and let it attach to them without knowing that it's harmful. So now I'm going to talk a little bit about how we test for it. This has been one of the big issues in our country because once this all started, we had to create a test for it, make sure that it worked accurately, and then make a lot of them so we could test everybody with symptoms. So what it is this nasal swab that is like a little Q-tip that a nurse will stick in your nostril and go back to about here. So it goes pretty far back, and then kind of swirl it around for 10 seconds to try to catch anything that might be back there. And then it goes into a little vial and it gets sent to a lab where they run all these tests to see if the virus is detected to determine if you are sick with the coronavirus. So we made a lot of progress in making these tests, but there's a lot more progress to go because there's still not enough tests everywhere to test everybody. They're also working on an antibody test right now that is a little newer, and that can be done after you recover from being sick. So if you've been sick, once your symptoms are gone, this test determines if you have antibodies for the virus. So once you get a virus, your body creates these antibodies that help fight it off. And this test, if it determines that you do have the antibodies in your body, it means that you have been infected with the virus in the past. So now I want to talk a little bit about how to protect yourself. So the coronavirus is spread through droplets. So if you cough or sneeze, these droplets are spewed into the air, and they can travel about 6 feet before they fall to the ground. So this is why we've created the 6-foot social distancing rule. If a droplet, let's say you're sitting across from a friend and they cough, that will go 6 feet before it falls to the ground. So if you're 6 feet away, it won't reach you. If you're closer, it'll reach right and can go into your body. So one of the best things we can do, or one thing we can do, is wear a mask to protect ourselves. So I believe in Maryland, you're actually required to wear a mask if you have to go out in public to the grocery store or something like that. So I have some examples here. This is a cotton mask. A lot of people around the world are making these right now and donating them. So it just goes over your face and you tie it in the back. So these are really great for the general public to wear. Then this is a surgical mask. This is what we wear in the hospital for any patient that has a droplet infection. And then this one is an N95 mask. And this is a really great mask because it fits very tightly against your face. And it also filtrates airborne particles. So it's the best one to not let any airborne particles come in. And that is what we use in the hospital for coronavirus patients. And while that is this is the most effective mask, it's not recommended for the general public because there is a shortage of them and we need to save them for hospital and frontline workers that are caring for infected patients. So these are the best for the general public. The last thing you can do is wash your hands. This is the easiest and best way to prevent yourself from contracting and spreading the virus to other people because we touch a lot of surfaces and that's how it can get easily spread. This is a tough battle that we're fighting, and it's an ongoing battle. A lot of people are working very hard to contain this virus and solve this pandemic. They're trying to make a vaccine, but that can take over a year to find and successfully create one. So the timeline of relief from this virus, we don't know yet. But we just have to keep on fighting. I've been hearing all kinds of things that St. Andrews students, parents, faculty, and alumni are doing during this time to help others and make a difference. And it makes me so proud to be a part of this community. We each play an important role in the containment of the virus. St. Andrews is strong, and we will make it through this. Stay safe, everyone.
Such important knowledge today from Becca Davis and Miss Anderson, and we appreciate their time and their attention to this, to helping us understand more about it. We have more we want to learn and more we want to share. So next week, we're going to look at this coronavirus pandemic through the lens of the economy, through the role of faith and spirituality at this time, and an overall look at mental health and wellness during times of pandemic. Thanks to everybody for paying attention to this. I know it has raised some important questions that your advisors and I and Ms. Egan and Ms. Magner, Mr. Tuber, Ms. Spire, all of us can help you to think through as we all try to understand what's happening and what's the impact of what's going on around us. See you next week.